Dr. Farrell, what are some of the diagnostic testing and the things that can be done to help to aid to diagnose thyroid problems that may occur in an individual? What do you guys do from a radiology standpoint that helps determine if someone has a problem?
Well, one of the most common ways to image the thyroid is a nuclear medicine scan. The thyroid gland takes up iodine or traps iodine because it uses iodine to generate the thyroid hormones that Dr. Levy was speaking about. So we can use that characteristic of the thyroid gland to image the gland. And by giving a small dose of radioactive iodine, which is given administered orally, we can give the patient a small dose of radioactive iodine and then image the gland. Okay, and that lets us do two things. First of all, it tells us how much iodine the gland is taking up. And there's just like you have a normal range for your TSH and your thyroid hormone levels, there's a normal range or their normal value of iodine uptake for the thyroid to take up in a 24-hour period. So we give the patient the small dose, we bring them back in 24 hours, and we can measure how much of that iodine that we gave them the day before has been taken up by the gland. And whether the gland is taking up a normal amount of iodine or not enough or too much can tell the endocrinologist a lot about the patient's thyroid gland and how it's functioning.